Cancer can happen at any age. Even in newborn babies, a baby can be born with cancer. So these are rare things. Unlike adults, environmental factors don't play much of a role in childhood cancers. It is now thought that we are all born with a propensity to cancer, and it is all because of different changes that happen in the genes that lead to cancer. One cancer which is quite common in our country as well is retinoblastoma, that is cancer of the eyes, and retinoblastoma can be a familial cancer. Right now we are treating a child whose mother had two brothers die in childhood from retinoblastoma. And this baby, well, the child is now almost 3 years old, had been having symptoms for months, but nobody picked it up because the awareness is so low that these cancers can be familial. And if it's a familial cancer, then screening must happen. The commonest cancer by far in children is blood cancer, cancer of the blood, or leukemia as it is known. Children also get certain unique types of cancer which are not seen in grown-ups. Leukemias of childhood are different biologically from adult leukemias. Children develop cancers of kidneys. The liver cancers in children are hardly ever seen in adults. The good thing about childhood cancer is that many childhood cancers are curable, provided they get proper treatment on time. Children's bodies are also unique in that they can tolerate much more treatment than adults. In our country, the problems with childhood cancer are several. One is very low level of awareness. So by the time they come to us, the cancer is quite advanced, and sometimes the curable cancers get out of hand by the time they come to us. And the other problem in our country especially is poverty, poor resources. So even if a cancer is picked up, there isn't money to treat the cancer. Cancer treatment is extremely expensive. It is very, very costly, no matter what sort of a setup you're working in. It could be a trust hospital like ours, it could be a private hospital, it could be a government setup, but it costs enormous amounts of money to treat cancer. The diagnostics of cancer, the different investigations that are required cost a lot of money. Biggest cause of families opting out of treatment, saying, no, I can't treat my child, is because there is no money. 70% of children with cancer in our country will not get treatment unless somebody else pays for it. Families, when I tell them that your child's got cancer, it's like the sky's fallen on their heads. They're so distressed. Lots of tears, lots of crying, and lots of guilt that what did I do wrong? Why did my child have cancer? After all those tears, the first question that comes is, how will I do it? How can I do it? And despite all the reassurance that we help you, the fear is always there. That my child is going to die. What are we going to do? If foundations like yours did not come forward, if they did not help, most families would abandon treatment. So foundations like the Genesis Foundation and a lot of others who are coming forward to help, they're making a massive difference. Without it, it's not going to happen. See, a child is a possibility. The child I'm curing today might become a great physician or a great scientist or a great writer or maybe a great leader of nations someday. So this is carrying forward the mother's work, because whenever we think of an image of Mother Teresa, she had a child in her arms. And if you take forward the children, it would be wonderful.